One of the tests that we do in this office is based on the fact that stress, trauma, and toxicity are the three major reasons why people get a variety of illnesses and dysfunction and malfunction in their body. So this toxicity can come in the form of many different chemical and natural substances from the environment that get into our body. One of those is heavy metals. Now, we can test for a variety of different ways to see if there are heavy metals in the body and if the body is clearing them out of the body the proper way. The proper way is within the cell. The cell actually packages that heavy metal, surrounding it with proteins, sort of like you use a garbage bag to wrap up your garbage, to take it out through the house so it doesn't get dirty. If the heavy metal is not wrapped up with the protein, then it is very reactive. It causes all this kind of free radical and oxidation damage as it goes through the bloodstream, through all the different organs, and that can cause damage. So the cell needs to package it, to transport it, and then the liver does its magic to wrap it up even more and to package it so it can be delivered through the large intestine and out into the outside environment. So that's the heavy metal process. How do we know if we are not packaging properly? Well, one of the tests we use is a heavy metal urine test, where we actually take a sample of your urine and we test to see if we are finding reactive heavy metals in the urine, and thus we will know if you are detoxifying at what level. Whether you're very, very poor, whether you're moderately poor, whether you're a moderate detoxification, or you're at a normal level of detoxification. So let me just show you briefly a couple of the little pieces of equipment that we use for that test, and that will give you a better idea of one of the tests that we do. So in doing the urine heavy metal testing, we get a sample of urine. This is obviously empty at the moment. We test it for pH, and then we adjust for pH if the pH is too low, in other words, too acidic. Then we take our pipette, we take 1 milliliter of the urine, and we add it to our test tube, which already, this is empty, but would already have a reagent in there that would react to heavy metals which are not bound, which are not encased in protein, and are coming out of the urine in a way that we do not desire them to be coming out. So we would put 1 milliliter in there, we would shake it again for 30 seconds, and then we would check and see the color. If it is no longer the bluish color of the reagent, or if it is not gray, starts turning pink or any other color, then we know that one has a very low detoxification capacity. So that's what we're looking at, detoxification capacity with respect to unbound heavy metals coming out of the urine. So in preparation for this test, of course, people have to avoid taking zinc, various supplements, various vitamin C, at least 36 hours in advance, so that that is not creating a skewing of the results. So that's how we do the heavy metal urine testing, to get great information about the necessity to do specific heavy metal treatment to help the body improve the way it is actually removing heavy metals from inside your body in a way that is safe and healthy. If that's not done, then your body will continue to have the effects of these heavy metals, including lead, including arsenic, including mercury, all of which are neurotoxic and have other damaging effects on other organs of the body. Hopefully, this has been helpful for you to better understand how we address some of the issues of toxicity in your body, which may be causing a deficiency, symptoms, and a decreased functioning of your ability to operate in the world at an optimal fashion. And that's what we're here for, is to help you optimize your health.